Matt Bonds.
And I'm Michael Rich.
We're two of Pivot's 4 co-founders.
Hi, Jim and Robin. Those are the other 2 co-founders.
We're here to tell you a little bit about Pivot's all about, how we came to be,
what we do, how we do it, and what our team has accomplished in the 2+ years we've been in Madagascar.
and why we think the work that we're doing is very important.
Madagascar is one of the poorest countries in the world.
In the district where we work, 1 out of 6 children die before they turn 5 years old. Expenditures on healthcare across the country is less than $20 per capita compared to $8,000 per year in the United States.
Our mission is to transform the situation. Our mission, in partnership with communities in resource-poor areas, to combine accessible and comprehensive healthcare services with rigorous scientific research to save lives and break cycles of poverty and disease.
A vital part of fulfilling this mission is sticking to our core values. Michael, tell us what those are.
Of course I will, Matt. Number 1, an uncompromising commitment to treat the sick and suffering using any and all resources and methods at our disposal. Number 2, a commitment to sustainability through meaningful partnerships, especially alongside the Ministry of Health and within the existing public health system. Number 3, a commitment to expand our knowledge and continue learning so as to better understand the communities where we work, to improve the effectiveness and the sustainability of our programs.
Which brings us to our approach. How do we do it, Michael?
Indeed, how does one break cycles of poverty and disease? Matt?
We at Pivot believe that combining the 3 following components is the key to achieving that goal. 1, delivering quality, integrated primary care and strengthening the health system. 2, supporting rigorous scientific research in order to optimize the health system intervention. 3, collaborating with local, global institutions and people that share our vision for human and environmental health.
That all sounds great, but it's a little bit formal, Matt. We've got to tell the people what Pivot actually does, like what sort of programs we have up and running.
Well, funny you asked. This is Ifanadine District. We want to transform this district to be a model of healthcare for the country of Madagascar. It has 1 district hospital and 20 health centers. The major work began in the hospital and 4 health centers.
That's right, Matt, and don't forget about our hundreds of community health workers that work in the front lines of health delivery. They're the backbone of the healthcare for these remote villages.
Ohatra za vao sabony aty amin'ny Toby dia raisina ety dia manao fandraisana zaza eo amin'ny fisy fandraisana tanana zahay. Dia ohatra zany misy zaza marary sy azonay raisina aty dia mandeha feny amin'ny ivony tovony CSB ranona famiko.
In Madagascar, even the poor generally have to pay for all costs of medicines and supplies. So one of our major programs is to completely remove the cost of essential medicines and drugs for the entire population where we work. A program that is barely more than a year old has already covered 46,000 patients.
We're working very closely with the Ministry of Health to transform the district's only public hospital, not only by improving its infrastructure and getting more staff into the hospital, but improving the quality of care that they deliver.
Speaking of infrastructure, our teams have worked to ensure quality facilities that are furnished with beds, reliable power, clean water, and basic diagnostic equipment.
Then there's the ambulance referral network. If you can imagine, prior to Pivot coming to Ifanadine District, there was no ambulance network. Now, there's 3 ambulances working 24 hours a day.
Dia orienté nay aloha zareo voalohany amin'ny communiqué amin'ny chef CSB. Dia chef CSB no miavertir anay rehefa hoe misy patient zao ary amin'ny fokotany eto zareo no misy an'zareo eto amin'ny toerana eto misy an'zareo dia alaina
Remember those 1 in 6 children that die before they turn 5 years old in our district? Most of those children die from respiratory infections, diarrheal diseases, malaria, and malnutrition, which are generally very easy to diagnose and treat. So not only have we implemented a program that provides those drugs for free of charge to those children, but we've also implemented comprehensive diagnostic protocols and treatment protocols to ensure that they're getting the best up-to-date modern medicine.
anatin'ny distrika ny fanadina aloha dia tsara ho marina fa raha pitaiko amin'ny toerana inesako taloha za fa nandehandeha any zay miasa fa tsy mbola nisy ohatran'ny eto kosa aloha ary za samy teny fa raha mbola distrika SSD angamba tsy mbola misy ohatran'ny fanadina angamba raha famp.
So, did you get all that? The bottom line is, here in the 21st century, where we have the technology that you can actually watch healthcare being delivered in a place as remote as Madagascar on your freaking iPhone, 1 out of 6 children still are dying from things like diarrheal diseases, which are easily treatable. In the past 2.5 years, we've already made extraordinary progress in helping transform the public health system. Unlike previous efforts, we actually have the data to demonstrate these transformations, sustain them, and improve them. It can only be through this shared basic respect for human lives and the common commitment to 21st century social justice that we can together break cycles of poverty and disease.